Around the world, scientists, laboratories, and public health experts are working behind the scenes to track and respond to some of the biggest threats in global health, including antimicrobial resistance. But this work doesn't happen in isolation. It's part of a much larger interconnected system, one that relies on collaboration, trust, and shared knowledge across countries and institutions. Welcome back to another episode of Bugs, Drugs, and Genomes. This is Ella, and I'm so glad to have you with us as we explore another fascinating aspect of AMR, global health, and capacity strengthening. Today's episode is all about what does it really mean to be a part of that global system? Specifically, we're diving into the role of the GLOCAP group here at DTU as a WHO collaborating center for antimicrobial resistance in foodborne pathogens and genomics. And that's kind of a mouthful to say, so we're going to say WHO CC, our collaborating center for short. So we're going to think about what does this actually look like in practice, and how does this partnership help contribute to keeping people safe around the world? To help us explore this, we're joined by the head of our research group, Professor Rene Hendriksen, and I'm also joined by a guest host today, Birgitte, a Senior Scientific Officer in the GLOCAP group who works across several of our projects. So thank you so much for joining us today, Birgitte and Rene, and without further ado, let's get started.
So welcome, Rene. I think we're going to have a really interesting discussion here about what is the WHO collaborating center really, because I think for a lot of people out there, it's going to be a little bit abstract. So could you just start by explaining us in more simple terms, what is a collaborating center?
Sure, Birgitte. So a collaborating center is sort of an extended arm from WHO. So WHO have a vision and they have some needs, but they also need somebody to help them facilitate and act on their behalf. And that is where they have identified expert labs around the world to facilitate that help. And that could be technical assistance, consultations, taking part in training courses, writing guidelines, protocols, etc.
Is there many collaborating centers? Are they covering a lot of different topics, or how is it organized?
There's, in fact, quite a number of collaborating centers around the world. So it's basically divided into topics. So we are a collaborating center for antibiotic resistance, but there could be collaborating centers for measles, mpox, influenza, whatever topic that are needed. And within each of the areas, there's also a number of other labs. I think that for antibiotic resistance, there's more than 70 labs, if I recall.
So can you take us back to how the group actually became a collaborating center? What is the story about this?
Yeah, that's actually a very long story, because we have been a collaborating center for almost 25 years by now. It all started with Denmark trying to ban the growth promoters that were used to raise food animals, and that was back in the mid-90s, where that was one of our focus areas, and it ended up that first Denmark and then the rest of the Europe banned the growth promoters, and right after that, Denmark focused on also establishing surveillance of zoonoses and also antibiotic resistance. And WHO heard a lot about all of that. And then they saw the need of having collaborating centers in antibiotic resistance. And then we were sort of approached, and we wrote a program, a 2 years trial program. And after those 2 years, we were basically appointed or designated as a collaborating center. So there's probably a lot more to it, but then I would talk for another 30 minutes. But I think this is the short version.
That's fine, thank you. And what is it that we actually do on a day-to-day basis? What type of activities or tasks are we assigned?
Yeah, so we designated every second year, and that means that there would be sort of a work program, and there would also be, I think there's about 3 to 5 term of references, and that means that within each term of reference, there's some specific task. That could be, for instance, establishing a training course somewhere in the world. It could be consultations in terms of facilitating guidance for whole genome sequencing. It could be providing external quality assurance schemes, sort of a ring trial for certain labs. So there's quite a broad number of activities that we apply to. So on a daily business, we would help WHO convene all these activities.
Okay, so what challenges do you see when you are doing all this work within the group?
So the main challenge is still time and money. So basically, when you are designated as a collaborating center, you are not offered financial support. So basically, this is working based on the honor of being designated. So a lot of all the work that are done by the collaborating centers are basically in-kind contribution by those centers. And we have done that since we were designated. But that's not entirely correct, because last year we were fortunate enough to receive a bit of funding from the Danish Ministry of Public Health to support our collaborating center activities. And that was the reason. That was the reason was basically that the Danish Ministry of Public Health have identified antibiotic resistance as a focal point or area for the next 4 years. So it's basically part of that strategy to engage more in international collaboration. And because of that, they would like to fund our activities, or some of them, in that sense. So we are very grateful for that funding from the Danish Ministry of Public Health to support our activities.
And over the years, I mean, what have you seen? What progress has been made, and some of the gains that has been achieved?
So working as a collaborating center is a long-term sort of progress. So there's no easy shortcuts. It's basically a long-term investments in the work. So looking back at these almost 25 years, we were definitely at another place back in those days, where surveillance was a word that not a lot knew about, especially when we talk about zoonosis and antimicrobial resistance. And that is opposed of today, where most of the member states have national action plans, how to conduct and facilitate the surveillance. That does not mean that it's established, because again, there's a great lack of funding for all of these activities, but at least they know what to do and have planned for it. And that is what have happened during the last 25 years. That is basically a lot of communication, transfer of knowledge, advisory service, and building plans and roadmaps, and conducted training. So member states would be in a stage where they would be ready to facilitate surveillance and public health actions based on the data generated. The big problem, as it is of today, is the lack of funding, both nationally and regional, and you could say also globally.
And what about this cross-sectoral collaboration? Has that changed over the years? I mean, now we're talking about WHO, it's public health, but I mean, nowadays everybody talks about One Health.
That's right. So in the beginning of the 19th, I think that most working in this area were focusing on the different sectors. So there was the public health sector, there was the animal health sector, and I think those two were probably the main ones. And they did not per se collaborate across, but that have also been strengthened greatly over the years, so that of today, there's I think that we are all talk about One Health, which is the cross-sectional collaboration, talking about public health, animal health, and how to strengthen the surveillance across, because that we all know that pathogens are transmitted across the borders and domains and sectors. So it's important that we collaborate across. And then we are not only talking about public health and animal health, but also the environment is important, and plant health. So when we talk about One Health, it's not only animals and humans. It's a more broader concept of all different sectors. And this is the reason why WHO have also, along with FAO and UNEP and OHA, set up the quadripartite collaboration. So that's basically the four major organizations that have set up a joint office and secretariat to align all of their activities and surveillance efforts.
How do you see that this will ultimately sort of contribute to keeping the people safe?
So if we have sort of a collaboration across all of the sectors, and we facilitate capacity building, lab strengthening, and knowledge to the member states, then we, in theory, would have sort of a global surveillance of infectious disease and antibiotic resistance. And that means that we would gain data. And if we apply also proficiency tests, external quality assurance schemes, ring trials, so that we are ensured that the data are sound and reliable, then we can start taking action based on those data. And an action would be translating that data into public health actions to ensure that we control and prevent, limit infectious diseases and antibiotic resistance. And by that, we would ultimately save lives. So that is also why it's so rewarding to work with those organizations and in this area, because it's actually quite meaningful. It means that you basically go to work with the best intentions to save the world. It might not be true, but at least we do whatever we can. Thank you, Birgitte.
Thank you.
Yeah, thank you so much both for that fascinating conversation. It was really interesting to get a glimpse of what it means, especially in this larger picture. All right, so we're just about ready to wrap up this episode, but before we go, I have a quick quiz, as always, for our lovely listeners. And today's question is, what does WHO CC stand for? Is it A, World Health Organization Collaborating Center, B, World Health Organization Country Center, or C, World Health Organization Clinical Center? And the answer is A, World Health Organization Collaborating Center. Kind of thinking about all the collaboration that we just discussed between different sectors, different countries, different regions. So thank you so much for tuning in to another episode of Bugs, Drugs, and Genomes. Stay tuned for our upcoming episodes where we'll continue to delve into the research group's work, AMR in policy and practice, and fascinating career insights. Don't miss it, and we'll see you next time.